36 factors seems like a big number.
Yeah.
To the average person or patient, that sounds intimidating. Can you talk a little bit about that? What does that translate into for me as a patient?
So that's the question that people start to ask us is, they'll read the book. Like I say, he's got a great book, Dr. Bredesen, and he actually lays it out really well. But people look at that and go, okay, I want all this testing. And I'm like, okay, but there's a priority system and an application to the testing that's still difficult to pull off. 36 things at the same time is still logistically a nightmare, especially for someone who's having brain problems. They're already forgetting where their keys are and sometimes who they are. And so trying to get them to follow a very rigid plan of 36 things is nigh impossible. And so part of it is in prioritizing, systematizing, and making it doable. So of the 36 factors that Dr. Bredesen identified, we tell people you're not going to have all 36. You're going to have 15, you're going to have 12, you're going to have 20 of them. So there's just a process of trying to identify those and then start, to fix enough of them to where you start to get better. So what we start to do is divide it in our clinic. Okay, here's step one. So I can tell you the first thing that we do is we have kind of a basic test we'll run. We recommend fundamental blood testing that involves insulin and inflammation. Those are the big things you're looking at. Blood sugar, insulin, there is so much research saying this is a fundamental problem with Alzheimer's. People have called Alzheimer's type 3 diabetes. This is an absolute thing you have to check. Then we check inflammation markers. He's got 3 that he suggests. And then if we can, we really like to do an MRI. So what we find in Alzheimer's and other conditions is there's certain areas of the brain that have really changes in volume. So what he's doing, and actually there's several people in different areas of health that are taking a brain MRI, throwing it through what's called a neuroquant, which is just a computer analysis of the MRI that sizes pieces of your brain. So you can actually see through our neurological exam and through the MRI, this area of my brain shrinking. The most common area of the brain for Alzheimer's is the hippocampus, which has to do with laying down new memories, which is why it's usually short-term memory that is affected first. But you have other patterns as well with certain types of brain problems. So you can both confirm the diagnosis of the Alzheimer's, and then what's nice is you can actually see changes in areas of the brain, before and after volume changes in the brain. So that's really where we start. You go with insulin inflammation testing, a thorough exam, look through the history, and then if you can, the brain MRI with the neuroquant attached is fabulous for starting the evaluation process. Now from there, he puts you into, are you a type 1, type 2, or type 3? So first thing we do is that fundamental thing, we start to address those. That might be B vitamins, omegas are in there, omegas are in our initial, so omega-3 ratios are one of the things he found. Really easy to fix if it's a problem for you. So that's an example. So what that's going to do after the initial test is it's going to put you in a track to go, if you're a type 1, these are the most important issues to address, so here's what we do next. If you're a type 2, then we have a different path to follow. So if you divide the 36 factors, they really fall into one of 3 categories. The first category he calls hot or inflammatory. And inflammatory is usually coming from a bug imbalance. So we live in balance with 40 trillion bugs. So if you're a type 1 and you have inflammation markers that'll usually be positive on testing for this, you're going to start to look at gut balance, good bugs, bad bugs, viruses, tick-borne infections, Lyme disease, things like that. But you're usually starting to look at your microbalance in a hot type 1 case. You're also looking very, very heavily at insulin, which we have in the fundamental role for everyone, but it's even more important for a type 1 because insulin is actually an inflammatory hormone. So you're really dealing with inflammation, you're dealing with bugs in type 1. From there, if there's a problem, we're gonna try to address it. So if insulin's a big problem for you, we're gonna really harp on the insulin solutions. Let's say your insulin's perfect. Well, then you don't need to spend the effort or time on that. And that's a big concept for people because you have a limited amount of effort. And if I put it in something that's not a big deal for you, then what happens is you run out of effort for the right things. In type 2, this is called cold. And this is not that you have something on fire, you don't have a bug, creating so much inflammation, creating a problem. You don't have insulin creating a problem. What you just have is you have a lack of the good stuff. So we tell people, if you think about a marriage, you can have marriages that are fighting and have these problems. That's type 1. It's on fire. We got issues. We got conflict. Type 2 is just cold. It's not bad. It's maybe just neglect. You just don't have any of the good, the happy, the life-giving stuff. So type 2 is all focused on what healthy things are you missing. He does a whole thing that Dr. Bredesen likes zinc. Zinc's fabulous for your brain. For type 2, it's you just don't have enough zinc. You just don't have the hormones. Hormones have a huge role to play in brain health. You just don't have the hormones that feed your brain. You don't have some of the vitamins that feed your brain. So type 2s are all about adding all those good things that really help your brain be healthy. Now, type 3 is a toxic type, and that's usually coming from an exposure to something like mold, an exposure to a chemical or a pesticide, or heavy metals or something like that. So type 3 is actually very, very different than 1s and 2s, and it plays out a little bit different. Both type 1s and 2s look like Alzheimer's. They look like you have memory problems, you're starting to forget things. Type 3 actually usually looks like a depression, it's very unresponsive to antidepressants, or it can turn as like you can't process numbers as well, or you can't speak. We have people that comes up with speaking problems or verbal problems. And it's only later when people do like an image, they go, your brain looks like an Alzheimer's disease patient. So these people actually can look very different, and then we realize, oh, this is a version of Alzheimer's. So it has a very different tract. But that's usually what you're doing. You're trying to find 1, which is the hot, 2, which is the cold, you're just missing all the good stuff, or 3, which is some form of toxic exposure.
That's a really good explanation. Thank you. That makes a lot of sense. As I'm listening to you talk about this, could someone ever overlap between the 3?
When I read his book, I remember messaging Dr. Paul, and he's going, okay, he's got 3 types, but he's got type 1, 1.5, 2, and 3. I'm like, couldn't we have just said 1, 2, 3, and 4? Like, why did we create 3? Well, the reason he has 1.5 is because it's a combination of 1 and 2. And what I really have found going through this is because type 2 is just, can you add in good things? A lot of people will have elements of part 2 in their program at one point in time. The difference is just in the priority. So people will say, well, couldn't I add good things at any point? And I go, yes, you could add zinc at any point, you could add healthy hormones at any point, and that's not bad. But what we find is if you're breathing in mold every day of your life, trying to help you give zinc or give testosterone or an estrogen balancing thing, it doesn't have the same benefit when you're breathing in something toxic, or you're exposed to some crazy amount of a heavy metal or something like that. That's the bigger deal. So if you have something in the category 1 or 2, you often have to handle that before you can get to just adding in, oh, you need vitamin E, oh, you need zinc, oh, you need a better B vitamin. That stuff doesn't work when you have these big fires on either side. So let's say we found some inflammation high on them. Okay, we're going to start to dig through history. Let's say they have a lot of gut problems. Okay, you have a lot of bugs in your gut, so we might do a stool panel. You find they have yeast overgrowth, so we're going to try to get rid of the yeast overgrowth, and then you see the inflammation markers come down as you get rid of the yeast overgrowth. We're then going to do healthy things for the gut, so we're going to do probiotics, fiber, things like that to flow into it. So that may be how a patient initially looks, is you go from one phase, figure out what the problem is, that puts you into the next phase, and you can have a couple things in that phase. It just takes time to walk through this process. We have people who go, my gut's terrible, I don't understand, I take a probiotic. I'm like, well, you have a worm, and the probiotic doesn't get rid of that. Or you have a crazy yeast overgrowth. Well, the probiotic doesn't fix that. So a lot of times adding in good things like vitamin E, it's great, but it doesn't fix the fact that you breathe in mold and are exposed to a toxic mold. So we find a very important thing is if there's something kind of inflammatory wrong, you have to kind of remove that, get rid of it, and then often adding in those positive things works. Whereas if you add in the positive things and then go breathe mold, it doesn't.
Sure.
Maybe their hormones are terrible, right? Another patient might come in and you do the initial, it's all the same, but they don't have gut problems, but they've had hormone problems their entire life, and their hormones are bonkers. And you go, well, hormones are really important, especially for a type 2. You really appear to be a type 2. Let's start to work at getting your hormones optimal. And so that person may look at really a lot more hormone optimization. Sometimes we'll partner with some of our friends. We have a couple endocrinology friends who, if we can't get it with natural means, we'll start to partner with them to get the hormones optimized for your brain and for your brain health. So Dr. Bredesen has a diet that he basically recommends as part of his protocol. And he is not the only Alzheimer's researcher to notice that insulin's a huge factor. So almost every Alzheimer's type program is going to involve blood sugar handling at a certain level. And the number one thing you can do to reduce your risk of Alzheimer's, I don't care what type it is, I don't care the number one thing you can do is not be diabetic. So what Dr. Bredesen recommends, which is just, you'll find this all over, is what he calls a KetoFlex 12-3. So KetoFlex 12-3 is a keto-based diet where you go 12 hours of fasting overnight, and the 3 is you stop eating 3 hours before bed. So let's say you have dinner at 6 o'clock, 7 o'clock, you're gonna go to bed at 9 or 10, so you wanna make sure there's a 3-hour gap between the last time you eat when you go to bed. And then we want to eat, again, we want to go 12 hours between eating. So if you eat dinner at 6 o'clock, we just don't want to eat breakfast till 6 o'clock. So you go 12 hours. Now this is a very fundamental feature, but fasting for that amount of time induces a lot of healthy things for your brain. And this is a very, very healthy pattern to get into for multiple reasons: weight, diabetes, and it's turning out brain health as well. Now, the key with his KetoFlex, and this is where we'll start to get some kickback because people go, I don't want to do keto. Keto's bad. I heard bad things. Isn't that the Atkins diet? I heard that was evil. We go, okay, hold. And he will say this as well. A KetoFlex done right is very high in fiber, very high in vegetables. A KetoFlex done wrong is no fiber and all bacon. These are some of the oversimplifications people do. So when he really lays out his diet, what we find is it is rich in fibers, it is rich in fruits and vegetables, it does have some protein in it, it does have some healthy fats in it, but really the key to doing this correctly is a diet that we all fundamentally know is right. Hey, guess what? We're gonna fit in more fruits and vegetables. We're gonna fit in healthy proteins. We're gonna take away a lot of processed food. That's across the board what people do. I do think Dr. Bredesen's rules of the fasting time, rules of the time before bed are very healthy guidelines to do. It doesn't matter if you follow that exactly, but every researcher everywhere approaching Alzheimer's is gonna do some things to help lower insulin levels, lower blood sugar levels, and so you just need a doable strategy that executes that well. This is a reason why when we do testing, we check blood sugar, but we actually check insulin. This is not standard in America. We just check blood sugar and we assume insulin does some things. Insulin will go wrong before the blood sugars go wrong. So by checking insulin, you can be more proactive than just checking the blood sugars alone.
That's a really good point. So that leads me to the one obvious question, which is, what you do here in your clinic is different from what they would experience if they went to, let's say, even a neurologist or their physician, their MD. Can you draw some comparisons and tell us what to expect with you versus MD?
Unfortunately, patients, you're in the middle of a war at the moment. Alzheimer's disease, from the medical perspective right now, is you're doomed. And here's some care, here's some people that'll be nice to you as you go through this, which we think is good, but there's no hope. We're banking on a drug maybe being developed. I will tell you, that's not in sight. There's not a drug that's been developed to either slow, reverse, or stop. And so they will tell you there's no cure for this, there's no treatment for this. Here's some care facilities, you might want to try to budget for it now, and it's going to be expensive, and it's going to be terrible, and it's going to be stressful, and I'm sorry. Hopefully they'll be compassionate, but that's about it. And here's some drugs that haven't really been proven to work great. They may work temporarily, but the trials haven't been great on them. So that's one side. And then on the other side, we have now some functional medicine people going, hey, there is hope. If we understand this, there really is hope. And now, for the first time, we have a doctor who's kind of screaming from the rooftops going, I have people who have actually gotten better. Now, when the paradigm is you're doomed, there's no way to get better. And so even hinting that there's hope, we get kickback like, well, that's just mean, that you're wrong. There's not hope. Don't even give it to people. And we think that if there's going to be hope for Alzheimer's disease, we're just at the very beginning. You're just on such the early phase of that this is even possible. We think in the next 10 or 20 years, this will now be the norm. But it's going to be an uphill battle right now, because the accepted paradigm is there's no hope, just be compassionate to people as they leave. And really, we're trying to challenge that and say, no, there is. We have an understanding for it. We have a protocol that will work. It's just not one thing. It's a process. And so we just have to bring you through the process, but there is hope. There are people who have recovered from this. So please have hope. There's a way to do it.
That's great. Thank you for sharing that. How do the drugs, the prescribed drugs, fit into all of this? If someone has been diagnosed with Alzheimer's,
sure,
and they come to you, can your protocol be used in addition to whatever their MD is giving them?
Absolutely. So we often get asked, can I do this while I take the med? And the answer is yeah. Dr. Bredesen uses some of the meds in some of his program for people, but he also stresses you can't take the med and not do the program and expect it to work. He's like, we have thousands of cases, if not millions of cases at this point, of documented that won't work. But you can absolutely concurrently take the meds for Alzheimer's disease while you do some of these programs. It just takes time to walk through this process. And you have to be able to kind of track it and stay consistent. This is hard with people who are having memory problems. They are very difficult to stay consistent because they can't remember. That's the whole problem. So a lot of this just takes a little bit of time to walk through. Now, another thing that we'll do with patients that's in our clinic, very important, because we're either doing an MRI of the brain and or Dr. Paul's exam, we can identify parts of the brain that are problematic. And we're going to start to do neurotherapy aimed at helping that part of the brain regrow and connect and learn again. So that's how a patient may look. There are always going to be some fundamental factors, and then there's going to be other parts you just work through. And you try just to line them up and knock them down. But you're not going to do all 36 things on every person. Almost every person at one point gets to a micronutrient test. So that's where we're just saying, what's your vitamin A? What's your vitamin B1, 2, 3, 5? What's your C? What's your D? What's your E? What's your chromium? What's your, we start to just go, what are optimal levels of these nutrients? That's a step almost everyone gets really excited when they can get to that. They've kind of gotten some of these other things out of the way. But it's often, even in the simplest of Alzheimer's patients, it's often a 3 to 10 step process. You can do some things simultaneously, but there's a sequence of things that has to happen in order to just get enough of the things. Okay, this is the problem, let's address it, get that addressed, check the next thing, just keep knocking them down, working through and knocking them down, and that's how you see the progress. Versus the medical paradigm, which is, if I can't get it in one thing, it's over. So we find just walking people through the process, if they understand that, usually it's test, yes or no, test, yes or no, test, yes or no, and you just walk down the path with people. Yeah.
Have you had patients that have had to take less of their medicine once they start on this protocol, or how have the patients reported back to you on this protocol?
So these protocols are really cumulative, and that's why the medication works well with it. Usually the Alzheimer's medications are really just aimed at memory function, and so people don't usually go down on some of those. They're just happy that their brain works, and they go, I'll just keep it all rolling. But to see even mild improvements on some of our testing, or to have a wife say, oh my gosh, he's actually there, or to say, I found my way. I've been getting lost for years, and I literally went exactly where I was going, is feedback that goes from these scary episodes of people getting lost, people not knowing where they are, people being confused, to all of a sudden those episodes stop happening. Like, yeah, I went on a trip. How'd it go? It was normal. How'd your last trip go? It was a catastrophe. I got lost, misplaced my keys, didn't know where I was going. I showed up at the wrong time, I showed up at the wrong day. It was just, and I had to kind of smile and laugh. Like, oh, I guess I'm just, ditzy. A lot of times is the way people will play it off in the beginning. And then they went, no, it's functioning again. I'm working again, I'm sharp again, I'm here again. So those are the kind of things you hear, especially if it's an early case. People are just playing it off as ditzy, and then they went, no, I was sharp, I was on it, I remembered the details, I remembered that guy's name, I remembered his daughter was da-da-da, and it helped us make that connection. And all of a sudden now I'm doing a good job at my work, or doing a good job even at home again, as opposed to where I was hardly functioning.
I would almost imagine that as people work through this Alzheimer's protocol, that there would be, if they're dealing with other health issues, that this would help with that as well.
This is a common theme that we find in functional medicine is it possible to have Alzheimer's disease and that's your only problem, you have no other health problems? And we think sometimes modern medicine has just divided things up so minutely that we go, oh yeah, you have Alzheimer's disease, but otherwise you're very healthy. And this protocol, and really functional medicine in general, says that's impossible. It is absolutely impossible to have Alzheimer's disease and not have another health challenge. So we're really looking for the links into why your brain's dysfunctioning, and to do that, oftentimes there's hints in other parts of your physiology, or of your testing, or of your health. So yeah, we fix a lot of other health problems on the way to helping people with their Alzheimer's.
That's awesome. Any parting words before we wrap this interview up?
The best message I have for people with Alzheimer's disease, or if you're caring for someone with Alzheimer's disease, is there's hope. This is a new message for Alzheimer's disease. It's been a long time of telling people, you're doomed, I'm sorry, I'm so sorry, but you're doomed. And we are now at the beginning cusp of, hey, there's people who have actually recovered from this. There's documented cases, people have recovered from this. He's made a process that others can follow. And we are at the cutting edge. This is brand new. This is an infant in as far as medicine goes, but there's hope. And we're really excited to see this hope grow and blossom into really becoming the standard over the next 10 and 20 years of Alzheimer's care.
Awesome. Thank you. Thank you, Dr. Kyle.